Image-guided needle biopsy is a minimally invasive and highly accurate method for biopsying a lesion discovered in the breast.
When a suspicious lesion is identified in the breast, a biopsy is done to take a sample of that tissue in order to decide whether this is cancer or some other benign process. Traditionally, in the past, the only way to do a biopsy was to take a patient to the operating room, put them under anesthesia, make an incision, and take the lump out through the incision. More than 80% of the time, those biopsies were benign. The patient, of course, was left with healing from the surgical biopsy and the risks of anesthesia, which go along with surgery. For approximately the last 20 years, needle biopsy has become best practice.
At Hoag Breast Care Center, our team of breast imaging experts are highly skilled at performing the latest techniques in minimally invasive needle biopsy, which is the standard of care at Hoag and is considered the preferred method for determining the nature of a breast abnormality.
A needle biopsy is just as accurate as an open biopsy, and actually in some studies it could be even more accurate because it's so precise when guided by ultrasound or mammography. Many organizations feel that needle biopsy is really the way to go. There's a recent consensus conference that was published in the October issue of the Journal of the American College of Surgeons that states that needle biopsy is the best practice, it is the gold standard, and here at Hoag we have adopted that. We have made needle biopsy of the breast the standard of care. In other words, it's the way we believe every biopsy should be done.
Therefore, if your breast imaging study and/or a physical examination has revealed an area of concern, be assured that you are in expert hands. Hoag's multidisciplinary team of radiologists and breast surgeons are well-versed in performing a full range of leading-edge breast biopsy procedures, all of which are promptly scheduled to reassure patients and minimize anxiety. The way a biopsy is performed is tailored to the area of concern within the breast and will be determined by the radiologist and surgeon. Most breast biopsy methods rely on image guidance such as mammography, ultrasound, or MRI. These tools allow the radiologist to precisely locate the abnormality within the breast and take a sample for analysis.
In an image-guided needle biopsy, local anesthesia is used to numb the breast, and then a special biopsy needle is inserted. It's guided to the lesion in the breast using either mammography, ultrasound, or MRI, whichever technology images the lesion best. The needle tip is placed within the lesion, and samples of the lesion are withdrawn through the needle. That tissue is sent to the pathologist, and the pathologist evaluates it and decides what the lesion is, whether it's cancerous or not. That result will dictate any follow-up that's needed. Stereotactically guided needle biopsy is generally used to evaluate calcifications that are found within the breast which are deemed suspicious. In a stereotactic biopsy, X-ray is used to guide a needle to specific calcifications within the breast that are then withdrawn through the needle in order to make a diagnosis. The patient generally has very little discomfort during the procedure and needs no sedation other than local anesthetic to the area where the biopsy is being performed. The patient lies on her belly throughout the exam. The affected breast hangs pendulant through an opening in the table and is gently compressed below. X-ray images are utilized to localize the calcifications within the breast. Once the tissue is numbed, a small incision is made and a special biopsy needle is inserted into the breast and advanced to the level of the calcifications to be sampled. Confirmatory images are obtained, ensuring that the biopsy needle tip is at the site of the calcifications to be biopsied. Sampling then begins, and those calcifications are removed from the breast. The tissue samples obtained are sent to pathology, and the pathologist evaluates them and gives a diagnosis. You should experience no discomfort during your examination. Although you may feel some pressure during performance of the biopsy, you should experience no pain. Understand that because only a small skin nick is made to allow the needle to be introduced into the breast, that small incision generally heals completely, and often no evidence of the biopsy being performed persists. After your biopsy procedure, you can generally return to normal activity the very next day.
It is normal to feel nervous or frightened about having a biopsy. However, it's important to know that the majority of breast biopsies do not turn out to be breast cancer. In spite of a woman's reservations about breast biopsy, the results can provide peace of mind, since breast biopsy is generally a definitive method for determining the nature of the abnormality.
Patients that undergo a needle biopsy for diagnosis are usually able to be informed about those results within 1 to 2 business days after a biopsy. Communication is carried out between the Hoag Breast Care Center as well as with that individual's physician to let them know about biopsy results. And patients are also scheduled to return to the Hoag Breast Care Center for a wound check to make sure that they're doing all right after their biopsy. And if their physician has given permission, our staff is also able to share their biopsy results with them and go over what that diagnosis may mean in terms of additional treatment and management. Although the majority of breast biopsies will be benign, in individuals that do have a cancer diagnosis, their process will be facilitated through a nurse navigator.
If you will be undergoing a needle biopsy, you will be given special biopsy preparation instructions by your physician. It's important to follow these instructions and call your physician if you have any questions.
Here at Hoag, we really strive as our gold standard to offer a needle biopsy to obtain a tissue diagnosis, as it's only 1 to 2 cases in 100 that we may not be able to obtain a diagnosis in that fashion. So if a patient is informed that, or it is recommended to them, that an open surgical biopsy be undertaken to obtain a diagnosis, you may consider a second opinion with a dedicated breast radiologist to see if needle biopsy may be an option.
For more information about Hoag Breast Care Center, please call us at 949-764-5780 or visit our website at www.hoag.org/breastcare.